Healthcare in Rotherham is undergoing a major transformation. The aim is to revolutionise the way healthcare is provided for Rotherham's communities. You could say, with a population of around 260,000, Rotherham has 260,000 beds where people can be cared for. These are in people's homes, care homes, hospital, wherever they are receiving care. Deciding which bed the patient should be in would depend on the type of care or support they need. In any situation, all patients would have a team near to where they live who know where they are being cared for and how they are being looked after. This would be known as the locality team. In our new community care plan, Rotherham is structured into 7 localities. Each locality will have its own local network of GP surgeries and community care settings with the support of the care team specific to that locality. The team will be known as the locality team for that area and is made up of GPs, a community matron, community nurses, therapists, social care workers, mental health workers, a hospital physician, and voluntary sector support. The locality team are all working together to manage their population's well-being. Here's an example of how a locality team would work in practice. Mrs. Jones has a fall at home and fractures her hip. She is brought into hospital by ambulance and admitted to a hospital bed for treatment. The next day, a daily list with Mrs. Jones's name on arrives at her locality nursing team, so they now know Mrs. Jones is in hospital. The following morning, a community nurse from the locality team visits Mrs. Jones. Mrs. Jones has had her operation, so now everyone pulls together to get Mrs. Jones back home. At Mrs. Jones's locality team meeting, all members are informed what the community nurse found out on her ward visit. Mrs. Jones is elderly, but in good health apart from the fractured hip. She has no immediate family and the incident has left her shaken. She's worried how she's going to cope. The locality team want to get Mrs. Jones out of the hospital system and get her back home as soon as possible where they can give her the support she needs. Between them they arrange meals on wheels, walking aids, a voluntary helper to do her garden, and a therapist to work with Mrs. Jones to build up her muscles. Liaising with the hospital, they arrange a day for Mrs. Jones to get a lift home, and when she arrives home, everything is in place for her. Now let's look at patients who are in hospital recovering. They can be there for several days whilst they are treated. When they become well enough, they could be sent home, monitored by a community nurse who visits every other day, and the consultant on his virtual ward round could see and talk to both patient and nurse. The only difference is the patient is using their own bed, not a hospital bed as they recover. Locality teams will not just react to people who are already unwell or need their support. In future, the teams will be doing more in the promotion of self-care through education programs and well-being events such as diabetes screening and offering advice on diet. So the people of Rotherham are not only supported in getting well, but staying well too. Changing where and how care is provided is a big change. Our challenges include recruiting the right staff, using better IT solutions, working in new ways, and integrating more closely with various care partners. This plan is already well underway. For example, we already have community matrons and nursing services operating in localities 24 hours a day and providing some services 7 days a week. There are also specially trained nurses working with the care homes. We now need to build on this so that our vision becomes a reality by the end of 2017. Thanks for watching.